Amen. Please be seated. Dr. Paul Byrne is a board-certified neonatologist, pediatrician, founder of the Neonatal Intensive Care Unit at the Cardinal Glennon Children's Medical Center in St. Louis, clinical professor of pediatrics at the University of Toledo College of Medicine, member American Academy of Pediatrics and Fellowship of Catholic Scholars, past president of the Catholic Medical Association, formerly clinical professor of pediatrics at St. Louis University and at Creighton University in Omaha, professor of pediatrics and chairman of the pediatric department at Oral Roberts University School of Medicine, chairman of the ethics committee of the City of Faith Medical and Research Center in Tulsa, Oklahoma, author and producer of the film Continuum of Life, widowed father of 12, grandfather of at least 36. Forgive me for that abbreviated introduction to Dr. Paul Byrne. Please welcome Dr. Paul.
Thank you very much. We did live in Omaha for 5 years, and we enjoyed it a lot. And sometimes, we lived in St. Louis for a number of years, and 5 of our children still live there. And here in Omaha, one of our sons lives here, Dr. Tom Byrne, who's a pediatrician in this area. And so they tease about how as we move, some of our children stayed, or you could say, they say, as our children say, we dropped them off. And of course, we were well established in St. Louis, and it took tremendous courage, I would say, for all of us to come to Omaha. But we look at it like we did a lot of good in Omaha, and it was a blessing that we came. To continue on the blessings when we came, Tom married Ann, my daughter-in-law, Ann, who's here, and so I'm blessed to have that. And then my granddaughter Caroline came to hear me too, and they did it without my bribing. I just thought I'd tell you. I sit down when I talk. I'd rather stand, but one of the things that I first observed a number of years ago when I would give a talk standing behind the podium, by the time I give the talk and get done, my legs didn't move very well. So I did go to the doctor and check out whether it was my arterial supply or whether it had to do with my veins or nerves or whatever it is, and they really couldn't come to much conclusion, but it was easy to find out because as my children and family and grandchildren found out about it, they said, well, maybe Grandpa, you talk too long. Today, we have a number of things that we have to go through, and our goal is to hopefully that you will know more about them when we're done. The Hail Mary is already said, and usually I begin the conference with the Hail Mary, but I also add the simple little prayer that I use often, and we can say it together. I'll say the first 3 things, and then I'll say come Holy Ghost, come now, come as you wish. And what I do when I do my work is I start with 3 of those. So come Holy Ghost, come now, come as you wish. Come Holy Ghost, come now, come as you wish. Come Holy Ghost, come now, come as you wish. I am one of the founders of the field of neonatology, and I was a leader in that, and we started special care nursery at Cardinal Glennon Hospital in 1963. And then what happened, I had a baby, Joseph. You can show the first slide. It might be up there, ready? Show the first slide. But Baby Joseph was born very prematurely. You can see a picture of baby Joseph. He's very small. He would almost literally fit in my hand. To get some idea about the size of him, that adhesive tape that's on his face there is a ½ inch wide. You can see the ventilator tubing connected to Joseph. He was on the ventilator for at least about 2 weeks at that time, and Joseph wouldn't move. He wouldn't respond. There was so the question is, what do we do now? And it was suggested to do a brainwave test in EEG, which we did, and the report came back consistent with cerebral death. And so I saw death on Joseph's chart, and I saw Joseph, and it didn't match. So I called the neurologist. I say, Harvey, what do we do now? He said, well, just repeat it. And so we did in a couple of days, and it was reported as unchanged from the previous one. So I say, Harvey, what do we do now? He said, well, some places they turn off the ventilator. And I said, well, I don't do that. I treat babies, some live, some die. If we can have the next slide. And that's a photograph of Joseph when he was 7. Later, Joseph married, has 3 children, but it was because of Joseph that I began to study the question about brain death and organ transplants. And as Sister already mentioned, and what an honor it is to be on the same program with Sister. Just a few weeks ago, Sister Deirdre and I were on the same program, and that was the first time that we had met each other. Obviously, we were able to identify because we have the same last name, and as far as I know, we're not at least immediately biologically involved, but she clarified our relationship because I'm her adopted uncle. I guess that makes her my adopted niece, but anyway. So it's because of Joseph that I studied, and you hear things about COVID, and Sister mentioned some of them, but one of the things that you heard about data, and you heard about science. And when I was paying attention to this with COVID, that's very similar to what happened with brain death. There's little or no science behind the development of brain death. It would not be acceptable in any kind of scientific study otherwise. And data, the same as the data was with COVID, was minuscule if there was any data. It's the same way with the development of brain death and organ transplants. The next slide. I have to remember to advance them up here too. So Joseph is like every human person. He's one. Each one of us is individual. We have internal metabolism. We have things inside of us, and there's spatial limitation, and it's there. So each one of us is one specific, unique, unrepeatable person with a soul-body unity. During life, there's an interdependence of cells, tissues, and organs. They're integrated as systems, so we can communicate about them. There are 11 systems in the human body, of which 3 are vital that we have to have: the circulatory system, the respiratory system, and the brain. It can also be called a system, but in order to stay focused because of the attention to the brain, it's circulatory and respiratory system and the brain. There's no single organ, not even the brain, that's the integrator of the body. The human person, there's a unity of the body and the soul, and then to quote the Catechism of the Catholic Church, because of its spiritual soul, that the body made of matter becomes a living human body. That's it is in Catechism of the Catholic Church 365, and that was formally declared by the Council of Vienne in the year 1312. a brochure that was given to me. I gave a talk in Indianapolis, radio, and as I finished a radio program, a lady came to the door and said, I was told to give you this. And it's a brochure and has a quotation from St. Anthony of Padua. The life of the body is the soul. The life of the soul is God. Life on earth is somewhat like a line that you can draw on a board. It has a beginning, it has its ups and downs, it has its end. Human life begins with creation. Each one of us begins with creation, and we can know that a new human life has begun at conception. And yes, there are important events in life. Birth is an event, it's important. Graduating from high school, getting married, these are important events. Eventually, life on earth ends, and the end of life is an event called death. And at death, the living substance changes to the dead remains, and the dead remains is manifest as destruction, disintegration, dissolution. It's clearly different and there is a change that happens at death. Now, the creation of the person is very important, and you'll hear more about that from you, Owen, and what a blessing he is that you will have so much to learn from him. It's a soul-body unity, and if you say, well, I don't know anything about souls, the spiritual, most people have something idea with spiritual, so you can use the word instead of soul-body unity, have spiritual-physical unity. And then some people say, well, I don't know about that. Well, how about immaterial and material? And most of the people know that there's something immaterial. Even you say, what's 5 times 3? And you say, well, 15. Well, what's the material? There are things that are clearly immaterial that have to do as persons. Tom and Ann have a cute little dog, Andy, and they teach him things, but we couldn't say to Andy, I'll meet you at Grand and Lewis, Grand and whatever in St. Louis next Wednesday afternoon. You couldn't do that. You can't do that. So persons are able to reason. The way God set it up is that creation is a very special thing. God created everything in the universe, and he set everything in motion, and it's all reproduced. Everything is reproduced except what? The person. Each person is new and unique, and while he did all of that of setting everything up, he also set up a system that the only way he can create a person is with a man and a woman, a husband and wife. Ideally, that's the only way. And see, why does God create us? God creates us to show his goodness and to get saints. And what is our responsibility? God picks us out as parents. The parents are picked up for the child, so that the parents then have the responsibility to teach, educate, and to get them to be saints. That's what we do as parents. The creation of the person and husband and wife are procreation. They are for creation, and the creation of the person is with sperm, egg, God, soul, immediate. So there's a time when the person isn't, and there's a time when the person is. At conception, the first cell, a Latin word would be conceptus. The biological term is zygote. But when the zygote is there, the conceptus is there, we can know that a new human person has been created and is on earth. Preservation follows creation. What's necessary for life on earth, for us to live on earth, there has to be blood. There has to be circulation of the blood. And of course, the heart is the pump that pumps that around. We also give other things to the heart. But the heart is just fascinating. because the heart has its own little brain. It has its own nervous system. It has a place where the heartbeat begins and it sends an impulse with tiny little nerves to every part of the heart and makes it contract. And you know what? It's so fascinating because it makes it stop doing that too. And that's essential for the heart to feel. So it has its own little nervous system. It isn't necessary for the heart to beat. The brain is not necessary for the heart to beat. The beating of the heart is intrinsic to the heart. Respiration has to do with our relationship to the environment. We need oxygen in, carbon dioxide has to get out. Circulation delivers oxygen and other things to the tissues. Metabolism goes on. Waste product is carbon dioxide, and then that has to get out of the body. Without circulation, we're dead within minutes unless something gets done about it. Without water, it takes 1 to 2 weeks until we're dead. Without food, 1 to 2 months. And the people who starved, at least in World War II, the people who were in concentration camps without food, they suffered tremendously, and there would be things terms that the whole rest of their life they always carried some kind of food with them. It was so awful. And as Sister mentioned, when the people get into this condition where they don't give them any water, any nutrition, any food, any water, it has to be awful for them, whether they can express it or not. There has to be a proper temperature of the body, and we know about fever. We know about getting cold, but a proper temperature of the environment, and exits for urine and for stool. At death, the soul-body unity is no longer. The living person is changed to the dead remains. A dead body without life, a corpse, a cadaver. And everyone is either alive or dead. There's no in between. Death has to do with destruction, and it's very, very important that you learn that term destruction. You can maybe think about it in terms of structure and then destruction, and the tearing down of that. And of course, you can know that the destruction is manifest once you can smell the corpse, that kind of thing, or whatever you can see. But the destruction is there when death is there. And no one ought to be declared dead unless the respiratory and circulatory systems and the entire brain have been destroyed. Notice I said that in the negative. It's worded in the negative to protect the living person, so that the person is not declared dead until there is destruction of those three systems. On the other side of that, if the systems are functioning or even have the capacity to function because they're not destroyed, the person ought not to be treated as dead. How do you treat a body? What do you do with the body when it's dead? You bury it, embalm it, and cremate it. And what they do now is organ removal. And that's what the whole thing about brain death is all about, is to get organs for transplantation from patients who are not dead. The brain death, what is that like? The patient is on a ventilator. That's very important because you hear other things that get confused with it, like vegetative state, that kind of thing. But the patient who's declared brain dead is always on the ventilator. What does the ventilator do? The ventilator delivers air with oxygen. Just delivers air. That's all it does. It's a pretty sophisticated piece of equipment. By the word Sister mentioned, PEEP, which is positive and expiratory pressure. I can tell you in little babies when we started, we didn't have any treatment and started in '63, but the first advance that we had was about 1970 when we found a way that was effective to give some end expiratory pressure that was continuous, and that was the first advance. So get back to the ventilator just a little bit. The ventilator only delivers air. The rest of respiration is gas exchange. And the gas exchange is oxygen in and carbon dioxide out. That's a physiological part of the respiration. Delivering of the air or the oxygen, which the ventilator does, is a mechanical part. And that's all the ventilator does, is mechanically delivers air. All the rest of it is done by the living person. The ventilator moves the air in. An analogy that you might think of is gasoline is put into the car, but that's not what makes the car go. So the other thing that gets confused sometimes is people will say the ventilator masks death. No, it doesn't. The ventilator only works when you're alive. It won't work on a corpse. The brain death has an absence of response to painful stimulus. There's no response to some brainstem reflexes. They check about 5 or 6 of them. The ones they check primarily have to do with the eye and the ear. Shine a light in the eye to see if the pupil responds, touch a little bit of the cornea to see if there's a blink, put ice water in the ear to see if the eye turns, turn the head and see if the eyes move, and then if there's a cough or a gag, an absence of those things. And you see, I said 5 or 6 brainstem reflexes. There's really 14 brainstem reflexes, but they test only about 5 or 6 of them. And then the apnea test, the apnea test, I'll tell you more about it in just a minute, but it's not a test for sleep apnea. Sleep apnea is different. This is an apnea test, and the patient is on a ventilator, and they have good color, they look good, their heart's beating, they got circulation. What do? In the apnea test, they take the ventilator away to see if they'll get a breath, and they take it away. Imagine a ventilator going at 20 cycles a minute, and if they took it away for 1 minute, they would skip 20 breaths. If they did it for 10 minutes, they skip 200 breaths when they do this test. It's an absolutely awful test, and if you don't learn anything else from me today, learn no to the apnea test. Everybody must learn it. It must not be done. EEG is recording of electrical activity from the brain. The EEG records electrical activity only from the outer, maybe ½ inch of the brain. Doesn't record anything deeper, and so they do it sometimes and sometimes they don't. It's not required, but if it is used, it has to be flat. But oftentimes you can detect something, and the goal and objective in declaration of brain death is to get them brain dead so they can get organs. In their declaration of brain death, destruction of the brain is not required. It's an absence of functioning of the brain, which is what's tested for. Again, brain death does not mean flat brain waves. It's not required to do EEG or CAT scans or MRI or blood flow studies, things that we think in terms of sophisticated medicine. Brain death is primarily a clinical examination, which means it's done at the bedside with ways that light in the eye, how bright is it? That makes a difference. How about the person who observes it? It's a fallible person, a doctor or someone else. It's not a sophisticated machine kind of thing. And the tests are for altered functions, not destruction of even the brain, much less destruction sufficient for death. When the tests are done for circulation to the brain, sometimes it's reported as no observation of circulation. And it's important to know that no observation of circulation is not evidence of no circulation. And that can be true with lots of other things also. Not evidence of is not evidence of none. And so you have to keep that thing in your mind. And one of the things that happens in all of us, we're all human beings, and we talk to each other, and we tend to talk somewhat, I don't know about loosely, but we don't discipline ourselves as to what the meaning of words are. And if you're going to study these life issues, begin with a dictionary. I have a lot of dictionaries. I have 3 that I use the most. At Webster's, most up-to-date Webster's, because it has a date. It has a date when the word was coined. And then I have an 1867 Webster's. It's the 5th edition of Webster's, and it has the roots of the words. And then I also have an 1867 medical dictionary, and it too has the roots of the words, but it has to do with the medical dictionary. You look up things, incidentally, the word abortion is putting together 2 Latin words, ab, outside, away from, and then ortium, like orbit. So abortion means to be born when you can't live outside the uterus. It doesn't mean to be killed. And so what happens, abortion as it's now used, is the killing of babies, but they can't stand to call it that, so they call it abortion. It's the wrong word. There's a lot of other things too about words. The sister mentioned euthanasia. That's a misleading term, because euthanasia comes from the Greek, EU meaning good, thanasia meaning death, and so good, death, mercy, killing, nonsense. Is there a Greek word that you can use? Yeah, it's epi-valo-thanasia. Epi from the outside, valo to be thrust upon, and then thanasia meaning death. So it's imposed death, it's killing. And so you have to use the words, have to understand the words and mean them, so we can communicate with each other as to what's going on. When declared brain dead, keep this in mind. Imagine it, declared brain dead. Patient has a beating heart, circulation, they digest food, they make urine, they control their own temperature, internal control. The thermostat's in the brain, by the way. Wounds heal, where they do the cut downs to put things inserted in veins and arteries and that. They heal. In 6 hours, they're healed just as fast as they are in any of the rest of us, at least sealed over. There's healing that happens. Brain death, let's see, did I say all of them? Yes. Okay, here's another one. If they get infection, they fight the infection. They get fever. Somebody who's called brain dead gets fever. And then when they cut on them to take the organs, their heart rate goes up and their blood pressure goes up. A study from Johns Hopkins University has good reputation. In 10 patients, they looked at this, and all 10 of them had an increase in heart rate and blood pressure when they cut on them to take organs. Would that have happened in a corpse? None of these happen in a cadaver. Brain death is not death. And you'll get a little card that has some of this on the back of it, and it starts out with brain death is not death. You have to remember that also. The apnea test, I told you about it. Ventilator is disconnected for up to 10 minutes. What happens during that 10 minutes is ahead of time they will give extra oxygen, and so some of their justifications, they say, well, they're not making them have less oxygen because they give them a loading amount of oxygen ahead of time. But the carbon dioxide accumulates, and when carbon dioxide goes up, acid goes up, and every doctor knows that acidosis is bad, and our many times as a physician, we'll try to get rid of acidosis because that's what we do. In the case of the apnea test, the doctor makes acidosis. It's a test that should never be done. what happens if the patient can't prove that he or she can take in her breath without the ventilator? Then the patient is labeled brain dead, and then it's legal to stop the beating heart, to cut out the heart and other organs. Say no, no, no to the apnea test. You have to learn it. You have to teach it to your friends and your relatives, and there's no reason to ever do an apnea test. Test for sleep apnea is okay. That's different. The ventilator is not a respirator. That's important to know. A ventilator means just move air. We have ventilation in this room. Respiration is the exchange of oxygen and carbon dioxide. The ventilator just moves air. It does not do respiration. It does not make circulation. Respiration is the exchange of oxygen and carbon dioxide in the lungs and via the circulation in all tissues of the body. Respiration is done by a living person. The ventilator does not work on a cadaver. The beating of the heart is intrinsic to the heart. The ventilator supports delivering oxygen into the body, but it does not make the heart beat. The heart beats on its own. If you just think about it, you can readily accept that as a fact, what I just said, because when they do heart transplant, they disconnect all the blood vessels and nerves and take the heart out and put it in somebody else, and it beats there. The brain's not connected, and there's no nerves connected. So the beating of the heart is intrinsic to the heart. And the ventilator does not make the heart beat. The beating of the heart is within the heart itself. Organs for transplantation, they have to be healthy organs. That means they're not damaged. The best organs are from people who are less than 30. People who are less than 30, their life is in jeopardy. If they get unconscious and on a ventilator, in fact of the matter is, anybody who's unconscious on a ventilator, the law says that they have to notify the organ procurement organization. That's so that they become aware of the fact that you're there, so that organs, in case organs become available in some way. Incidentally, the laws are written that they are in place. It's called the Uniform Anatomical Gift Act, but it's in every place. It says that they can do every test to you to see if your organs are transplanted are good for someone else. They can do everything, every treatment to keep your organs in good shape. And they can do all this without any kind of informed consent. It's built into the law that they can do that. Where do they get organs from? Primarily from trauma or not enough oxygen to the brain. And then overdose of drugs. They get so many more organs now from overdose of drugs, and how shameful it is, because what happens is it's oftentimes someone is getting treated for drugs, and then they relapse, and then they take a dose amount of drugs that they were taking before. It has a greater effect, and they quit breathing. And what's our system? Our system is very nice, because all the policemen, all the firemen, and many other people have Narcan. And Narcan is a great drug so far as counteracting the depression of breathing, but it helps them to breathe, but they need time for their brain to heal. But what happens once they get in the system, they get in the system because they are often young, they have good organs, and they get organs from those people. It's so shameful, the relatives, when we get in touch with them and in order to attempt them. The tissues for transplantation is different. A tissue is different. Organs need a supply of oxygen. Some organs need a continual supply, and like the heart, like the brain, without oxygen, the heart, the brain gets damaged quickly. The liver is also very similar. Kidneys, you have a little bit longer time. So those are organs. And then tissues, though, are different. And tissues don't have the same requirement for oxygen. the tissues don't get damaged so quickly. What are tissues? Ligaments, tendon, those kind of things. And then the cornea. God made the cornea without any blood vessels. All the rest of our body has blood vessels. If God would have made cornea that had blood vessels, we'd be looking through veins and arteries. But he made it so there's no circulation to the cornea. But the cornea needs oxygen too. So where does it come from? It comes from the environment through the tears. And so they can get corneas for transplantation because they're not damaged even several hours after there's no circulation. There's also a living donor. You know about a living donor. What is that? That's the donor is healthy. And the donor can give one of two kidneys to someone else or one lobe of the lungs. And these can be given and they don't die. And so morally, there's a way to do this, or part of a liver can be taken. In order to participate in that, though, there has to be full and complete information about the effects of the donation on both the donor and the recipient. And that's necessary for both to give informed consent. We hear things about informed consent. It's a legal term, and they use it, but you cannot get informed consent if you don't have information, to consent or decline. And that's absolutely essential before you can think about informed consent. What happens if you treat the patient who's declared brain dead? They can live a long time. I showed you the picture of Joseph. TK was a patient that I took care of at Byrne Mercy. TK was declared brain dead, and about 2 weeks after his declaration of brain death, the nurse called and said that his blood pressure was going down. So I went over to Byrne Mercy, and TK was in a child's bed connected to the ventilator. His mother was sitting next to the bed, and I said to her, I won't call her by name here. I don't know that it really makes any difference, but I don't want to take away from any of her. But I said to her, his blood pressure is going down. I said, do you want me to do anything about it? You got to know he's already been declared brain dead more than 2 weeks before. I said, well, do you want me to do anything about it? And she looked up at me and said, well, what can you do? I said, well, we can give medication, and sometimes the blood pressure will come up. And she looked up at me and she said, well, get on with it. I'll never forget her words. I gave him medicine for blood pressure. He was on it for just a day or two and then was able to get off of it. He lived 20 years after that declaration of brain death. The Jahai McMahon, a 13-year-old girl in California who had tonsil surgery, they had lack of oxygen, a fair amount of notoriety. Her mother got on the TV and pleaded, will someone help? Well, one of my sons was there and poked me on the arm and said, well, Dad, what are you going to do? So I called the airlines and I got a flight and I went to California. They wouldn't let any doctors in to see her. So how did I get in? Her stepfather was like on 10 feet or 20 feet on the other side of the guard, and I was on this other side of the guard, and he said, oh, Pastor, come on in here. And that's how I got in to see Jahai. And so they wouldn't even call her by her name. They referred to her as a dead body. They gave her no nutrition for more than 3 weeks. And so I met with her mother and stepfather and family, and of course you have to know that I don't have any license to practice in California. So how do we get treatment for her? And so I did meet with there were about a half a dozen of the relatives, but I made it very clear, if you want me to help, I will help, but it has to be quiet. I can tell you, they kept it quiet because still hardly anybody knows. You know a little bit of what I just told you now, but they didn't tell anybody else, and they still haven't. But we were able to get treatment started for her while she was in California, and then got her out of California and transferred to New Jersey. Again, to do it, we had to do it at nighttime, and got her out in an ambulance on an airplane to New Jersey. New Jersey is the only state that has a law that if the relatives do not believe in brain death, and they believe only that they do not accept death unless their loved one has absence of circulation and breathing and no heartbeat. It's the only state that has that law. So she was able to go from California, where she had a death certificate. Incidentally, they wouldn't let her out of that hospital until the death certificate was signed and recorded. The mother had to go to the Bureau of Vital Statistics before we could get her out of there and accept that her daughter was dead in California. Then we got her to New Jersey, and she was alive in New Jersey. and she got treated in New Jersey, and I went to see her there. The treatment that we got started in California and continued that and other things. Eventually she went home. She lived in an apartment. She lived more than 4 years. When I went to see her later on, her mother would say, "Give me a thumbs up," and after a little bit, her thumb would come up. Her mother would say, "Raise your left leg," and her left leg would come up. And remember, she was declared brain dead in California. And there's all this stuff about the criteria, and it's put out there, the Academy of Neurology criteria. She had at least 3 doctors on their staff who declared her brain dead, and then the court ordered a consultant, and a doctor from Stanford, who was a very prominent doctor, went to Oakland to see her and confirmed that he agreed that she was brain dead, agreed with no circulation, no evidence of circulation to her brain. And all of that went on with Jahai, and of course, we still get into these things because she lived for 4 years. They say, well, something was wrong with how we did the test, or they did the test, and that's always that happens. All of the patients that survive, they say they didn't do the test right or something. Alan, a 7-year-old boy in Montana who almost drowned, and get involved with this brain death thing. I went to Montana and got help to get treatment started for him. He lives at home with his mom and dad and 7 brothers or sisters. It's more than 7 years, and he continues to live at home. It requires, people that are like this. Their treatment is not so sophisticated once the parents learn how to use the ventilator and that kind of thing. How about these patients? Every one of them has a relative or someone who speaks up to protect the life of that person. And Sister mentioned about someone staying at the bedside. It's absolutely essential if you have someone in the hospital who is unconscious and doesn't know what's going on. If at all possible, keep someone there at the bedside. Obviously, things are done by doctors and nurses, and those of us who are not, we might not know so much about what's going on. And doctors, even if you know, I was at the bedside of one of my friends and who was on hospice, and I go to see her. I say, "Anna, do you want me to pray?" And she says, "Yes." I say, "Hail Mary," and she kind of frowns. I say, "The rosary?" She says, "Yes." We start the rosary, and Anna starts to sit up. The nurse says to another nurse, and in comes the hospice nurse and gives her another injection so she doesn't move. I mean, even when you're a doctor at the bedside, and I'm have a fair amount of experience with these things. It still happened so quick I didn't even realize what was happening. In any event, so have somebody there at your bedside. Instruct no to the apnea test. Now, we give out cards, and the booklet that I gave you has a copy of the cards, but it's a medical opt-out card. It's called that. It's there to protect and preserve your life. And what's the very first part of it? And don't look for it now. Pay attention to me. What's really important? You know, I've taught for a long time, and medical students study hard, and they fall asleep easily, and so you give them a lecture and they fall asleep, and that kind of thing. And so as things progressed, the students evaluated the teachers. And so one of the students wrote on their evaluation, Dr. Byrne's monotone put me to sleep. You know what? Nobody has slept in my class or audience since that time. And I can always find a way to get your attention, which I just showed you how I can do that. I used to be better at it when I could move around, but I'm kind of stuck here. But anyway, thanks for paying attention again. Don't look for the card now, it's there. What's the most important part of the card? The most important part, it says, I direct all medical treatments and care, including nutrition and hydration, that's food and water, however administered, be given what? To protect and preserve my life. So those are key words. You have to learn them for yourself, for your own good and for the sake of your relatives. Do not hasten death. Do not do an apnea test. Do not take any organ for transplantation or any other purpose. I have to tell you a little bit about the Uniform Determination of Death Act, because that's the law in Nebraska and essentially in all the states with some minor variation. But it's a law that reads like this: an individual, incidentally, I have trouble with that individual can be applied to lots of things. This is an individual table. This is an individual chair that I'm sitting on. So it's an individual. It's a very non-personal term that's there. But an individual who has sustained either one or two. What's one? Irreversible cessation of circulatory and respiratory functions, or two, irreversible cessation of all functions of the entire brain, including the brainstem, is dead. Now just think about it. If someone is declared brain dead, they could be declared brain dead, but they wouldn't fulfill the one at that time. It would just be the two. So and so if they declared brain dead once, what are they the second time? How about if you go the other way, what's called irreversible cessation of circulatory and respiratory functions? They still want the organ. So what do? These are patients that have some evidence of a functioning brain, so they can't call them brain dead, but they still want their organs. So how do they do that? They stop the ventilator until the patient does not have a pulse. And that's how it's written, until they're without a pulse. And so what's a pulse? A pulse is an observation of circulation in some way. You can feel it, you can record it, but they don't say without a beating heart, because they still have a beating heart many times. It might not be beating regularly like it ordinarily would for circulation, but it's without a pulse. How long do they wait until without a pulse? Two babies in Canada, they waited 1 minute and 15 seconds, and then that was the signal to cut their beating heart out. The standard thing that goes on throughout the United States is 2 minutes without a pulse, or 5 minutes without a pulse, depends on where you are. And then what do? They start everything, or just about everything up, but you see they're concerned that when they started up, there might be some functioning of the brain that returns, and then they would fulfill that. And so what do? As soon as they can get in there and get to the circulation, the carotid arteries, they clamp them off. to make sure there's no circulation to the brain as they make the rest of the circulation go and cool the organs so they can get the organs. And then the next part of it is a determination of death must be made in accordance with accepted medical standards. The way that it used to be was that standards were usual and customary standards, or they were ordinary standards, or they were reasonable standards. The first time that I was able to find when they used accepted medical standards was in the Karen N. Quinlan case, which is the index case of the Right to Die movement. And so what's the difference between these? Just think about doing an EEG, recording of electrical activity before you declare someone brain dead. It should be usual to do it, it's customary to do it, it's ordinary to do it, it's reasonable to do it, yet it's accepted not to do it. And that's what's in the law. The law, there's been a movement for a couple of years now to revise this Determination of Death Act. And so why is it? Well, let's look at this second part here. Irreversible cessation of all functions of the entire brain. What we've been able to do with patients is show, like in the case in Nevada, her name slips my mind, but it'll come back. But a 20-year-old girl who had got bellyache, was a college student, got into the system, got exploratory laparotomy, and never woke up after that. Never woke up. And so she had EEG done 3 times, and every time she had some EEG activity, but they said that didn't count. So they declared her brain dead. Anyway, that went to the Supreme Court in Nevada. We got a 7-0 ruling in our favor that they did not were not correct in declaring her brain dead. And then sent it back to the lower court. But in any event, irreversible cessation of all functions of the entire brain. It sounds strong, but I already told you they only do some of the brainstem reflexes. I already told you about some EEG sometime, and they say that's not relevant. Another thing they do, the hypothalamus, which controls temperature, salt and water balance, and that statistically 50%, about 50%, that's about half of the patients who are declared brain dead have salt and water balance. But they say that's not relevant. So you see what they did when they invented this thing called brain death, and it was all invented, and then when in 1981, when the President's Commission got involved and invented this law, and then what's written there is what's relevant are the clinical observations. The observations at the bedside are what are relevant, and which ones that are relevant, it's the ones that they say are relevant. And so they wanted to revise the law. We and other people did get involved in, and just so you know, we collected some signatures, a statement, collected some signatures. We got 854 signatures, and we presented it to the Uniform Law Commission in one group, one loop. Anyway, they have put it on pause, and their revisions. I don't know what pause means, but I am concerned they'll start it all up again. But what do we need to do in the meantime? We need to learn that an absence of function is not sufficient so far as death is concerned. There has to be destruction. So you have to learn that. And what do we say about declaration of death? We say there can't be any respiration, there's no heartbeat, no circulation, and it's due to destruction of the organs and tissues of the three vital systems. And then our recommended model statute, which is what we're pushing for, says no one shall be declared dead unless respiratory and circulatory systems and the entire brain have been destroyed, and such destruction shall be determined in accord with universally accepted standards. This is solidly based medically and ethically. So what are we doing while the Uniform Law Commission is put on pause, and incidentally bringing it up, let's us talk about it, because since 1981 we've had very little chance to talk about it because the system is all made up to get organs. What kind of a system is it? In 2020, the last year we have statistics, $48 billion was billed for organ transplants, of which doctors got $6 billion. So they're all part of the system. And you mentioned Catholic nursing homes, Catholic hospitals, they're all the same. They're all part of the system. Very little difference in them. Obviously, there can be some pockets of good doctors, hospitals, but the way they all get paid is that they get paid primarily by Medicare and Medicaid, that's called CMS, and then all of the private insurance companies follow the same rules. Now, in conclusion then, the soul is the life of the body. To be dead, it's a body without soul. No one ought to be declared dead unless respiratory, circulatory, and systems and entire brain have been destroyed. When declared brain dead, the taking of organs now, the way it is now, begins while the heart is beating with circulation and respiration. So I ask you, do you really want to be an organ donor? So, and I already told you what we're going to do with that and that, so we stopped there, and I kept pretty close to the time. And so if you have questions, or I would really request that you write your question if at all possible. The reason I asked for the question to be written is that it does two things. One is it gives a record, because when I can prepare for the next time I give a talk, I know what was asked. And then also I can, I have trouble with my hearing, and ask my daughter-in-law and my son and granddaughter. But I have trouble with my hearing, so I might not get it. But anyway, we're going to do whatever David says here.
I can say it really loud. It's easy to get brain dead in California, one, right? Secondly, the laws for brain dead are different in most states. They're not the same. The third is in locked-in syndrome, when people totally are apparently dead. There is even a movie, a French movie, in which they show a patient that eventually got better from locked-in. In locked-in syndrome, people are considered dead, but they really can hear and see things, but they cannot respond. Are you familiar with locked-in?
You're doing what I've just said, that in pointing out that people that are called brain dead are alive. Brain death is not death, and if you treat them, they live. I mean, I gave you examples. Those are examples of the ones that I have personally participated in their treatment and care. I didn't participate with Zach Dunlap, but I did go to Oklahoma to interview him. He was declared brain dead. He works as a park ranger in Oklahoma. Okay, David, you're running this.
We have time for one or two questions. Anybody?
Give him a second. You're right.
Dr. Byrne, what's your best recommendation for what we can do individually to have an impact on this culture of lies in surrounding brain death and mental health issues?
So David asked, what's the best thing we can do? I can tell you the best and most important thing to do is to pray. Pray a lot. And because this system, I have studied it for a long time. different angles, and so how did brain death get started? It got started. How did all this? It got started with a heart transplant in South Africa. Christian Bernard, some who are older might remember that. But 3 days later, they did a heart transplant in Brooklyn, New York. They cut the beating heart out of a 3-day-old baby and transplanted it into an 18-day-old baby. And after their surgeries and a little bit of time, both babies were dead. It was illegal. It was immoral. They did that at December 3rd and 6th in 1967. 1 month later, in January of 68, they set up a committee at Harvard. And the objective of the Harvard committee was to invent brain death and to make it legal. So you see, how did this culture of death started? Incidentally, brain death was invented in 1968. It started long before that. I think many of these things go back at least to evolution, and you'll hear more about that from you Owens. But evolution is a way that man can decide when things begin, and if you can decide that, you can decide when they end too. But brain death was invented in 1968. Roe v. Wade didn't happen until 1973. Would Roe v. Wade have happened if they had paid attention to brain death? I don't know. So I put that in there in terms, but what I'm trying to get at is that medicine changed in 1968, and then it continued. That article in 71, another one a little bit later, and once medicine changed, then the law changed. So what do we have? And then where was the church? Where was the leaders of the church in these matters in 68? So you see, what happens is that we have a culture of death, and it's more proper to say that there's a gift of life, and then it's a culture of death. It's what you can make of it. And what should doctors and nurses do? Protect and preserve life. That's all we should do. And if it's something else, it's probably not medicine. Okay. Has the medical field taken the Hippocratic Oath after graduation of medical students, and then they say specifically do no harm? The large majority of medical schools do not take the Hippocratic Oath anymore. Some of them will take a variation of it. And why did the Hippocratic Oath came about? Because 300 years BC, Hippocrates saw that was happening with medicine, abortion, and other things that were going on, and came up with that, and it stood very well. We took it when we graduated from medical school. Now, the other question that's up here is, what would be a good example of removing extraordinary means? Well, ordinary and extraordinary means is a whole topic in itself if you're going to get into it. But you can get some, perhaps, idea about it. It has to do with the means. It has to do with what you do, and there are things that are clearly ordinary means: providing food and water, keeping the patient normal temperature, keeping them clean, that kind of thing. Those are ordinary means, and there's an obligation to do that. Extraordinary means, when these things were, the moral principles were developed, things were different, and sometimes you could point out about how expensive it was, but everybody over 65 has the same insurance company, or you could say how difficult transportation was, because no longer do we have horse and buggy, that kind of thing. We have jet airplanes, could go all over the world. So the means isn't like it used to be. But here's what I would say is, every person is extraordinary. Every person. And if they have an extraordinary illness, why shouldn't they get the extraordinary means if that's available? Now, I'm not saying that everybody has to get a ventilator before they die. I'm not saying that everybody has to get a feeding tube before they die. And there are times when you do everything that you know to do, and there's a time when you don't have to do those things. But certainly, with the example that Sister gave, with Sister wanting to be with her other sisters, where the Eucharist was, the Mass, that kind of thing, that's so special. Why take that away from anybody? Incidentally, with the COVID, I've written 3 articles about COVID. If you want to read them, they're at www.renewamerica.com/columns/Byrne. And the first one I wrote had to do with nursing homes. My sister was in a nursing home. And so I learned about it. In the last year she lived, I got to see her only 4 times. And 2 of those were with glass in between. And the last time was 4 days before she died. And they wouldn't even give me a straw to let do that. They wouldn't give me any Jello. And they wouldn't let me come back the next day because they said I had my quota. And they wouldn't let me come back on Saturday the next day because I had already had my quota. She died on Sunday morning without anybody around her. And you have to know she was a very, very special person. And she truly was. Like this rosary, she made this rosary for me. And I'm going to stop pretty soon because I see Pam. And Pam has so much information to give you, and she's a real authority.
But don't stop there.
Now, I want to stop, but I have to also tell you about this rosary. My sister made it, and for those of you who live in Nebraska and might not realize that red and white are the Cornhuskers' colors, my rosary is red and white.